Hello, I'm Dr. Venus, and welcome to another episode of Dr. Venus On Call. I am thrilled to be kicking off my series, Manage Your Pain the Natural Way. We're going to be exploring how to manage your pain without having to resort to taking a pill or undergoing a surgical procedure. We're doing things naturally. Sound good? Well, let's get to it then. First, I'd like to give you this short disclaimer. What I am presenting today is for educational purposes only. It is not meant to be, nor should it be taken, as medical advice. Watching or listening to this video does not constitute a doctor-patient relationship. Today, I have partnered with Thermatex to share with you how to manage pain using hot and cold therapies. Heat and ice have been used for years upon years to manage pain, and so many people have found them effective for pain relief. There have been studies to investigate whether heat and ice really influences healing, but the results have been somewhat inconclusive for the most part. However, because these are low cost, relatively safe when used correctly, and they do make people feel better, I find heat or ice to be a great way to manage pain. But I get asked all the time which you should use, hot or cold, in which situations. And what about this alternating hot and cold thing? When should you do that? Well, here's the lowdown. Let me start with ice first. Ice is for fresh injuries. We call them acute injuries, which tend to be immediately painful and often result from traumatic incidents like a fall, twisting movement, or a direct blow. Ice cools the tissues and causes constriction of the surrounding blood vessels. So it controls bleeding, inflammation, swelling, and pain in this acute situation. Sometimes you can use ice to reduce any residual swelling after exercise or after physical therapy. It can be applied over an area for 15 to 20 minutes, 3 to 4 times per day initially, and then on as an as-needed basis. But the duration that ice should remain in contact depends on the size of the area being treated and the depth of the injured tissues. Frostbite and even injury to nerves has been described in some uses of ice, so cold therapy needs to be monitored closely. If you're simply using ice cubes in a plastic bag, I advise having a cloth layer between the bag and your skin, perhaps a towel or bandage wrap. Now, let me move on to chronic injuries. This is generally when heat should be used. It can help relax tight muscles, relieve achy joints, increase the elasticity of tendons, and increase blood flow to the area. You might also want to use heat prior to exercise for chronic injuries to warm up the muscles and increase flexibility. Heat therapy should be applied for 15 to 20 minutes in the form of a heat rub, hot water bottle, a warm damp towel, or a commercially available heating pad. And again, if you're using something like a hot water bottle, place a suitable layer of protection over the skin to prevent burns. But what about the alternating hot and cold treatment I mentioned? After about the first 3 to 5 days following an acute injury, once there is no bleeding and no signs of inflammation, you can consider alternating between hot and cold therapies. The theory behind this is to create a pumping mechanism of opening the blood vessels with heat and constricting them with ice. So you can alternate submerging the injured area in hot and cold baths, or you can apply alternating hot and cold packs. You can imagine that the heat encourages healthy blood flow to the area, while the ice helps disperse the lactic acid and other inflammatory agents. Now, there are a couple of cautions to be aware of when using heat therapy. Anyone with decreased skin sensitivity can be at increased risk for burns. So people with conditions like diabetes or spinal cord injuries should be careful. Heat therapy can also increase inflammation in those with rheumatoid disorders or multiple sclerosis. Definitely consult with your doctor before using heat if you have any questions or concerns. Up to this point, I've primarily discussed use of superficial methods of applying heat or ice, things like hot water bottles, plastic bags filled with ice, or an electrical heating pad. But there is another option when it comes to heat therapy, and that's far infrared heat. Infrared light is part of the sun's invisible light spectrum. It has the ability to penetrate deep into our body's tissues. Infrared heat therapy uses these characteristics of infrared light to heat the body directly, rather than just heating the air surrounding the skin. This is one of the major advantages of infrared heat therapy over standard heating pads. Superficial heat from a standard pad only penetrates a few millimeters deep. Heat from an infrared pad goes much deeper below the skin's surface, as much as 6 centimeters. That's a little over 2 inches. So an infrared heating pad can be much more effective for that deep chronic pain. And because it goes deeper, the pain relief can last longer. Another advantage of an infrared pad is one that I've already alluded to, and that's the risk of burns. If you were to fall asleep on an electrical heating pad, you could end up with a severe burn. But due to the nature of infrared radiation, you don't get these burns with infrared heating pads. It also doesn't cause drying of the skin, which can occur with superficial heat. When choosing an infrared heating pad, I think it's important to find one that actually covers the area you want to heat. Now, the pad does not need to be in tight contact with the skin. Remember that infrared heat penetrates deeper than a standard heating pad. But you should try to find an infrared device that has some flexibility to it, making it easier to apply to various areas of your body. That's why I like the Thermatex Platinum system. It has 3 separate infrared elements, which gives it the versatility to be used at different places on your body. You can wrap it around your midsection to relieve back pain. You can lay it over your shoulder, and you can even place it around your knee. And because you don't have the risk of burns like you do with superficial heating pads, you can leave it on longer. I recommend at least 30 to 45 minutes of treatment or more if you like. And you'll find benefit from using it anywhere from 2 to 4 times per day. You can order a Thermatex device elsewhere, but I've provided a link here for your convenience. And you can get a discount as well as free shipping if you use my promo code Dr. Venus X, DRVENUSX for the Platinum product, Dr. Venus, DRVENUS for all other products. Thanks for watching. I hope you learned some great information that will help you achieve safe and effective pain relief. This is just the start of my series, Manage Your Pain the Natural Way. I will be back each month with another way to naturally relieve pain. If you're interested in a certain topic or therapy, please message me and let me know what you'd like to cover. You can find my contact info at my website, drvenus.com. DOCTORVENUS.com. Until next time, stay fit, be happy.